I'm Kenza Bouayed from Casablanca, Morocco, North Africa. I'm a pediatric rheumatologist working in a university hospital, and I'm the head of the pediatric rheumatology department.
Hello Kenza, I'm Caroline Vinit. I'm a pediatric rheumatologist in Paris, and we are here to discuss about PFAPA patients and how do you manage this patient in a country where there is a lot of Mediterranean familial fever.
Yes.
So Kenza, can you tell us please how do you diagnose PFAPA in Morocco?
It depends of the context, and I will say that if the patient fulfilled all the criteria of the PFAPA, I will base my diagnosis on the clinical symptoms. But I will ask for inflammatory markers to be sure that we are in situation of inflammation.
When do you use genetics in PFAPA patients?
I will use genetics in maybe two cases. The first one is when there is consanguinity, because we have a lot of FMF, and we're a little bit afraid that this patient with recurrent fever could be a real FMF. And the second situation is when our patient doesn't fulfill all the criteria in situation of fever, recurrent fever, but without tooth, without pharyngitis, when the criteria are lacking.
Okay. So if I understand well, genetics is not systematic for you?
No, it's not systematic for all patients.
Okay.
There is a third situation when parents are not convinced by the diagnosis and they ask for genetics.
Okay. And in Casablanca, so when you use genetics, which test are you using? This is my first question. And my second question, can you tell us about the cost of genetics in Casablanca?
Yes, in Casablanca, we have two ways to ask for the test. In the private sector, and it is treated abroad.
Okay.
And it is really costly, about €600. And the second way to do is to send our patients in Rabat, in a public hospital, where they can do only the genetics on exon 10, because it is the most frequent mutation in our country in 694 V.
Thank you very much. And if we talk about treatment for PFAPA patients, what do you do, for example, if you have a PFAPA patient with an heterozygosity in exon 10, sorry? How do you manage this patient?
It depends of the type of mutation. If it is a validated mutation and he's symptomatic, I will give him colchicine. If it is a variant, maybe I will give him only corticoids during the flare.
Okay.
Did you already see some typical PFAPA patients where finally you will find a mutation for FMF?
Yes, but I will speak about the mutation E148, but it is a variant.
But for a real mutation, did you have patients with a real genetic FMF, but with a typical phenotype of PFAPA?
No.
So if you have a typical phenotype of PFAPA, then you can be pretty sure that you don't have
Yes.
FMF. Are you testing for inflammation in between the flares to be sure there is no clinical inflammation?
Yes, I do. I ask sometimes for amyloid A protein, and usually the inflammatory markers are normal between the flares. But in FMF, it's sometimes different. In our experience in FMF, we can have little bit inflammation between the flares. Thank you, Caroline. Thank you, Michael.